2 weeks ago, I was speaking in Lexington, Kentucky at the American Assembly of Men in Nursing. And I was specifically, this was about 5 days after the task force had come out with its recommendation, and I was speaking specifically about the challenges that I kind of foresaw coming down the pike as a result of this recommendation coming out. And it was interesting, after I got done with the talk, folks in the crowd certainly had many questions about where we go from here, but one specific gentleman actually stood up. He was with one of the top 3 health plans in this country and said, "Scott, I wanted to just share a little story with you." And I was like, I was interested to hear what he had to say. And unfortunately, his response was, I wanted to let you know that our leadership in this health plan has actually directed us in our HMO Medicaid to stop providing access to prostate cancer screening. So 5 days after the task force issued this recommendation, one of the top 3 health plans has already sent down direction from its very top leadership saying to no longer provide access to prostate cancer screening. And also as troubling is in that same letter, they were also instructed to stop providing access to breast cancer screening. So we in the prostate community are not alone in this fight. We're being attacked. Our friends on the other side of breast cancer are also being attacked. And so this gentleman, as he said it moving forward, is he does not suspect that his health plan will be the only one, that there has been some communication amongst other of these larger health plans that they're going to follow suit in this. So I'm here to kind of sound the alarm and say that just one presentation in Lexington, Kentucky did enough to scare me that one of the top 3 health plans is already backing away from providing access to prostate cancer screening for these men. So with that, as we look at the Affordable Care Act, one of the key pieces within it was that it was going to require coverage at no cost for all of the A and B rated screenings within the U.S. Preventive Services Task Force. So essentially what I'm looking at, you look at the 36 or 37 states that currently have a state mandate in place for prostate cancer screening. My question is, as the Affordable Care Act points everyone back to the U.S. Preventive Services Task Force as the model, as the blueprint, as those A and B ratings state, what are we going to do as a prostate cancer community to make sure that, number one, the state mandates are recognized and continue to stay in place moving forward? And then what are we going to do when men are forced to pay out of pocket for this screening, whether these state mandates are wiped out or whether these health plans no longer provide access to coverage? That's the doomsday scenario that I think is in front of us. What are we going to do when this access goes away, and what are we going to do when these men are forced to pay out of pocket? And once again, recognizing high-risk men, African-American men, those with a family history, and veterans who have been exposed to Agent Orange, within all these high-risk populations, are we really going to be asking them to pay out of pocket for this life-saving screening? It clearly has shown a benefit in early detection and prevention in many of these high-risk men. So the one piece I was curious about, if you guys have seen, how many of you have seen the President's report on his latest physical and checkup? Has anyone seen that? And we all saw that he was in excellent health, right? How many of you also saw that he got a PSA test in his annual checkup? So President Obama's a 50-year-old African-American man. In his annual health checkup, he got a PSA test. And it was interesting as you read the media reports to see what they had said. He actually got it as a result of, as they called it, informed patient request. So President Obama knew well enough that the PSA test is an important tool in terms of screening to let him know if he was at risk or if he had prostate cancer. So my question here today is, if President Obama knows enough to ask for the PSA test, what are we doing to ensure that all men are gaining access to the prostate cancer and the PSA test? So yeah, as we move forward from here, I think we have an ally potentially in President Obama looking at his annual physical and checkup. If the president has access to the PSA test, why can't all men, and specifically high-risk men, also have access to the PSA test as well? So if there's anything that we can do to leverage the coverage of his most recent physical and his great results of his PSA test, I think it would serve all of us well in the community to remind him and other leaders around that even the president is getting the PSA test, and he's a high-risk 50-year-old man out there. The piece I wanted to close with was talking about the current benefits that we also enjoy in Medicare. So the Welcome to Medicare also has a very rich prostate cancer screening benefit. For any man, as they enter Medicare, they gain access to a PSA and DRE test as a part of the Welcome to Medicare physical. So in my opinion, when you look at it, you've got a federal agency, CMS, saying clearly there's a value and a benefit in this for men as they enter Medicare. So I think the more that we can do to champion and hold up the Welcome to Medicare physical, and particularly what CMS has done, ensuring that men have access to the PSA and DRE for their prostate health is critically important. And I guess what I would close from is from the patient perspective. To me, overall, the PSA test doesn't hurt anyone. In my opinion, getting a PSA test knowledge is power, right? It's helping us make an informed decision. And I think the more that we can do to make sure that patients and their healthcare providers have all the knowledge and information as tools that they can use to make an informed decision about what they decide to do moving forward. In my humble opinion, I would argue that I really don't see the benefit in a task force or a committee telling me as a patient what kind of decision I should be making with my healthcare provider. So the more that we can put the power back in the hands of patients, empowering them with knowledge and information to make informed healthcare decisions with their healthcare provider, the better. So thank you all so much for your support, and we're looking forward to partnering with you on this move forward.